I'm now in conversation with Yazan Masannat. He's speaking to me from Aberdeen in Scotland, and he's one of the Cambridge Healthcare Training TalkSurgery Masterclass speakers. So today I'm going to find out a little bit more about Yazan and the work that he does and a little bit about his background before asking him to let us know what delegates can expect from these TalkSurgery Masterclasses. So, Yazan, just tell me a little bit about your job at the present time in Scotland. What is it that you do and what's your speciality?
Many thanks, David, for the introduction. My name is Yazan Masannat. I'm one of the consultants in Oncoplastic breast surgery, currently working in Aberdeen in Scotland. So mainly I treat breast cancer patients. I do the excisional work, which is mainly excising the tumors, and the reconstructive work for most of my patients, along with my colleagues here in the unit.
Okay, that's excellent. And I ask all of the TalkSurgery Masterclass speakers to tell me a little bit about what drives them, about their background. Why did you get involved in the medical profession in the first place? What was it that inspired you?
Since I was little, my dad is a surgeon, so that was the main drive for me to go into medicine and to go into surgery. And all the time when I finished medical school, I thought that I wanted to do a GI surgery until I started training in surgery and did a breast job. And the patients are so thankful, and they're excellent cohort of people that will want you to make the job and make you more passionate about doing breast surgery. And that's why I decided to do breast surgery at that stage.
Okay, thank you for that. And so tell me a little bit about the jobs, different jobs that you've had within the UK. You've worked mainly in the UK and Northern Ireland, I gather. So tell me a little bit about those.
I've trained nearly in every single country in the UK. So I worked in Northern Ireland, I worked in South Wales, then I've done a higher degree, a doctorate in Leeds in breast surgery. Then after that, managed to get a rotation as a higher surgical trainee in the London Deanery. I did my fellowship in Essex, and now I'm a consultant in Scotland. So I'm really very British. I've been to all 4 countries here. I've seen different units, different ways of doing things, and different trainers have trained me from different backgrounds, which is great. Gives you all that exposure to choose what works better for you and for your patients.
Now that's very interesting. Well, I'm pleased that you've worked all over the UK. that's I think it's the first time we've had someone as a speaker on the TalkSurgery Masterclasses who's been in every single country in the United Kingdom. I'd like to ask you now a little bit about your experience during the COVID-19 lockdown. There's been a lot of press and publicity saying that people are very reluctant to go into hospital and that COVID-19's had a big impact on the kind of operations that you do. Is this what you've found?
It's a yes and a no. So from the outpatient point of view, we kept on seeing all the urgent referrals and all the urgent suspected cancer referrals. Many ladies that have breast pain are the ones that we are not seeing or we haven't seen. Surgically speaking, we kept on doing oncoplastic breast surgery, level 1, level 2, and the only thing that we couldn't offer is reconstructive surgery, as in implant-based reconstructions or free flaps, but that is starting again soon. We have operated on more than 100 cancers since the lockdown. We have introduced new techniques that we will be addressing or talking about in some of those master classes in localizing breast cancer that helped us go through this difficult time. And it's cancer surgery, so it should be business as usual. We've tried to keep it business as usual as much as we can. Of course, there will be limitations because of what's happening in the country.
Yes. Looking at the kind of technologies that you've seen evolve and emerge during your time as a practicing surgeon, what technologies do you think have had the biggest impact on what you do?
As surgeons, we are always guided by our radiologists. So I think the most important advantages that helped our surgery to evolve is radiology. Because with more accurate radiology, you know exactly where the tumors are, you know exactly which breasts that you can attempt conservation or not, and you know which axillas you need to clear or not. So from my point of view, imaging and imaging technology is very important. Of course, other things like uh, treatments with oncological new medication and new targeted treatments is very important for the from the treatment and from the cancer point of view, but from the technicality and from the surgical point of view, I think imaging is more important for me.
Yes, that's a good point that you make. Have you been involved in robotic surgery at all? Is that something that's part of your profession?
In breast surgery, robotic surgery does not have really a role. Some people started looking at doing free flap surgery where we do the anastomosis using the robot. But that's something that we have not tried here in Aberdeen. I know that some other units have attempted that, mainly in the States. So robotic surgery is not that relevant in breast surgery.
Okay, and what about the outcomes of from patients with breast cancer? Have we seen major advances in the survival rates of breast cancer patients during your time as a surgeon?
The improvement in the survival rate has been picking up since all the advantages and all the advances, sorry, in breast cancer treatments. From a tumor that had an overall survival of nearly 40% 50 or 60 years ago to be more than 80% now, you can see a huge differences. But that survival advantage is not only because of surgical techniques, it's mainly also because of uh, targeted treatments, better chemotherapy, better radiotherapy, better targeted treatments, and better imaging that will pick the cancer early. So things are changing and have been always changing for the past decades, and hopefully will keep on changing and getting better.
So, looking now at the work that you do with reconstructive surgery, um, are your patients primarily people who've had mastectomies, or are you also involved in the cosmetic surgery side of things?
I don't do cosmetic surgeries for my patients. I mainly concentrate only on breast cancer patients. Though the operations are very similar, I think the cohort is slightly different. So I do breast reductions for ladies that have big breasts, but breast cancer in the breast. So I'll remove the tumor using the breast reduction, but I wouldn't do a reduction only for cosmetic reasons. I will do an augmentation for lady to symmetrize her if she had a breast cancer on the other side and reconstruction, but I wouldn't do, for example, augmentations only for cosmetic reasons. There's lots of medical, legal, and insurance issues that will come with that equation. And that's why I'm just more dedicated to my breast cancer patients.
Yeah, I can quite understand that. I found in my experience working with digital healthcare is that there is certainly with a lot of new technologies, digital technologies especially, there is a lot of fear of litigation as a result of something that goes wrong with the advice or the treatment that's delivered as a result of digital technologies. Before I ask you about your TalkSurgery Masterclass series, can you tell me a little bit about your passion for sharing what you do? I understand that you record some of your operations and that you have a variety of digital channels that you use to share your expertise. Would you like to say a little bit about that?
Since I was a trainee, I always felt that knowledge is for sharing. So I opened the website called ibreastbook.com. That website, with the help of colleagues from across the world, I have videos of most of the breast surgery techniques, from the simple lumpectomies to mastectomies to the more complex oncoplastic procedures to the implant-based reconstructions to the free flap surgery that are done by the plastic surgery colleagues and the microsurgeons. They're all open and free for people to have a look at.
You're one of the speakers at the TalkSurgery Masterclass series. What is it that delegates can expect to gain from your sessions?
My aim from these sessions is to cover what is expected from the modern oncoplastic surgeon to know. all the different techniques, all the different technologies that have evolved. So there'll be 6 master classes. The first one will talk about more about the basics of breast surgery and the basic of oncoplastic breast surgery with some simple mammoplasty techniques. The second one will talk more about volume displacement techniques and level 2 oncoplastic breast surgery, which is mainly the bigger mammoplasties. The third one will talk about volume replacement techniques, which is mainly the chest wall perforator flaps and the mini flaps. The fourth one will talk about implant-based reconstruction and the different ways of doing implant-based reconstruction. The fifth will be about free flaps and pedicle flaps, which is mainly done by plastic surgeons, but some of the breast surgeons are starting to do those techniques. And the last one will talk about revision surgery and symmetry, which is very important for patients with breast cancer for life to go on. So this will be more comprehensive, covers nearly every aspect that you need to know from breast cancer and oncoplastic breast surgery.
Thank you very much. I'm looking forward to hosting your TalkSurgery Masterclasses, and I just thank you for your time today in sharing a little bit about yourself and the work that you do. Thank you, Yazan.